Causative organisms: yeasts, Candida. Filamentous fungi, Fusarium and Aspergillus. Symptoms: gradual onset of pain, grittiness, photophobia, blurred vision, watery or mucopurulent discharge. Signs: Fungal Keratitis. Yellow-white densely suppurative infiltrate is typical. Filamentous Keratitis. Gray or yellow-white stromal infiltrate with fried texture and fluffy margins. Progressive infiltration, often with satellite lesions. Feathery branch-like extensions or a ring-shaped infiltrate may develop. Penetration of an intact disseminate membrane may occur and lead to endophthalmitis without evident perforation. An epithelial defect is not invariable and is sometimes small when present. Workup: staining of corneal scrapings, potassium hydroxide, Gram-and-Giemsa staining. Other stains include periodic acid Schiff, chalcoflower white and methenamine silver. Culture of corneal scrapings: Saburod dextrose agar, blood agar. Enrichment media. Polymerase chain reaction, PCR, analysis. Corneal biopsy. Anterior chamber tap. Confocal microscopy. Treatment: general measures are as for bacterial keratitis. Topical antifungals. Candida infection is treated with amphotericin B 0.15%, aconazole 1%, natamycin 5%, fluconazole 2%, clotrimazole 1% and voriconazole 1 or 2%. Filamentous infection is treated with natamycin 5%, aconazole 1%, amphotericin B 0.15%, miconazole 1% and voriconazole 1 or 2%. Cycloplegia. Cyclopentolate 1%, palmatropine 2%, atropine 1%. Subconjunctival antifungals. Fluconazole may be used in severe cases. Systemic antifungals. Voriconazole 400 mg twice daily for 1 day, then 200 mg twice daily. Itraconazole 200 mg once daily reduced to 100 mg once daily. Fluconazole 200 mg twice daily. Thank you.